Welcome to the District of Columbia Department of Health. In this video, we will give you a basic overview of public health accreditation. By the end of this video, we want you to know what accreditation is, the 12 domains of accreditation, who FAB is, the 7 steps to achieving accreditation, and what's expected of you in order for our department to reach accredited status. But first, let's take a look at what public health accreditation is. Accreditation is an evaluation of our department's ability to serve the District of Columbia and improve the quality of life for residents, visitors, and those doing business in our community. Achieving accredited status confirms that the work we do is important to our residents' well-being. This is an opportunity for everyone to be a part of a winning team. Our department is going to be evaluated on our ability to fulfill the 12 domains of accreditation. Let's take a look at these domains. Domain 1, monitor people's health. Domain 2, investigate health problems to protect the community. Domain 3, inform, educate, and empower people about health issues. Domain 4, work with the community to solve health problems. Domain 5, develop policies and plans to improve health. Domain 6, enforce laws to protect health and ensure safety. Domain 7, improve access to health care services. Domain 8, maintain a competent public health workforce. Domain 9, evaluate and continuously improve our department. Domain 10, ensure the use of best practices. Domain 11, guarantee successful operation of our department. And Domain 12, engage the mayor, city council, and other governing entities. Each one of us makes some contribution, whether big or small, to carrying out the work within these 12 domains. It is important for you to know these domains and how we will fulfill them. You might be wondering who will be reviewing our department. The Public Health Accreditation Board, better known as FAB, is responsible for assessing our department on the 12 domains of accreditation. FAB developed these domains and will use a series of measures to ensure that we meet their standards. It is very important for you to know who FAB is, as you may be asked to participate in the accreditation process more directly and may even be contacted by FAB during our evaluation. We want to reassure you that being an accredited health department is a really great achievement for our department and provides a lot of benefits for everyone involved. Some of these include celebrating our successes, identifying opportunities for our improvement, increasing communication and collaboration within our department, and providing more potential funding opportunities. Achieving accreditation lets our funders, partners, and community know that we are a trusted and high-quality organization. This process will help make your lives a lot easier and will help improve our community's health. Now that we know what accreditation is, what the 12 domains of accreditation are, and who FAB is, let's take a look at the 7 steps our department will need to take to achieve this status. The FAB accreditation process is divided up into 7 distinct steps. First step is pre-application, which is when the department is preparing and getting ready to apply. FAB requires us to complete 3 prerequisites, which are the Community Health Needs Assessment, the Community Health Improvement Plan, and an agency strategic plan. These prerequisites make sure that we engage our community to find their needs and set priorities that work to serve these needs over the next 5 years. The second step is the application, where we submit our application form and the 3 prerequisites to FAB. The third step is documentation selection and submission. In this step, we have to demonstrate to FAB that we fulfill the 12 domains of accreditation and meet their standards. The only way to show that we fulfill the 12 domains is to submit evidence to FAB. In order to submit all relevant work to FAB, the director has appointed an accreditation team and accreditation coordinator, and both will select and submit documents. While this may sound like a lot of work, all we really need to do is show FAB the work we already do as a department. The next step is a site visit. This is where a FAB-appointed peer review team will come and visit our department and make sure our documentation meets FAB standards and measures. Everyone, including all staff, community partners, healthcare providers, the City Council, and even the Mayor, will be expected to be able to answer questions about accreditation and the Department of Health during this time. This is why it is so important for you to know who FAB is and what we do to fulfill the 12 domains of accreditation. If our documents and site visit have been successful, we will reach the decision step and become an accredited public health department. The Department of Health would join a select group of leading health departments and will have achieved national accreditation and the benefits from it for the next 5 years. The work isn't over though. Accredited status requires continuous reporting. We must submit an annual report to FAB each year and continue to document our successes and services in the community. After 5 years, the Department of Health will repeat these 7 steps to become re-accredited. Now that we know how to reach accreditation, we need to let you know what is expected of you. While some people may be asked to provide documentation to the accreditation team, everyone needs to know about FAB, understand the 12 domains of accreditation, and be able to cite examples of our work in our department. As we said earlier, FAB will visit our department for 2 to 3 days and review our work by going through the buildings and around the community, conducting interviews, and checking documentation and program validity. This means that the whole community, including internal staff, our partners, and providers, may be questioned and must be aware of our work at the Department of Health. Throughout the next year, keep a lookout for newsletters, bi-weekly email updates, and promotional materials for accreditation, and make sure that you are ready to impress FAB. Achieving accredited status confirms that the work we do is important to our residents' well-being. The Department of Health will be nationally recognized as a leading health department, and the community will be assured that the work we deliver produces positive health outcomes. This is an important opportunity for all of us to strengthen DC's health. Thank you for your time taken to learn more about the Department of Health's accreditation process. We hope it was informative. If you have any questions, you may contact Venetia Verma with the DC Department of Health. She can be reached at 202-442-5829 or at accredit.doh@dc.gov. Thank you.